What happens when one of Britain's most outspoken television personalities finds himself at the mercy of the very system he just publicly criticised? That's exactly what unfolded for Jeremy Clarkson, the former Top Gear host, who was rushed to hospital for what he described as a Defcon 1 painful treatment, just days after calling the NHS a creaking old monster. The timing could not have been more ironic. Clarkson had recently written a scathing column about the National Health Service, questioning the quality of its care and even making controversial remarks about foreign doctors working in UK hospitals. But only hours after publishing that critique, he found himself in urgent need of medical help. For years, Clarkson explained, he had relied on private health insurance. But he claimed that over time, he grew weary of insurers finding loopholes to avoid covering treatments. His solution? Setting aside money in a personal account to cover emergencies. Unfortunately, when that emergency struck, Clarkson was 2 hours away from the nearest private facility. That left him with no choice but to walk straight into an NHS hospital, the very institution he had just lambasted. Clarkson admitted he felt uneasy as he entered the ward, even joking that he considered sneaking in disguised with a Piers Morgan mask. He worried that someone might recognize him, and in his words, urinate into my tea as revenge. But what he actually encountered was far from hostile. Clarkson said the staff were nothing short of professional, describing the doctors and nurses as kind, attentive, and dedicated. He quipped that he had slept in way worse hotels and praised the spotless facilities and even the food, which he jokingly referred to as kids' food brilliant. Most importantly, the treatment worked. They even made me better, he admitted, for which I shall be eternally grateful. And yet, even with that positive experience, Clarkson has not softened his views on the NHS. He insists that while frontline staff are excellent, the system itself is financially unsustainable. According to Clarkson, the only way to maintain the service at its current scale is through massive tax increases. He even warned that Chancellor Rachel Reeves would be forced to fleece absolutely everyone for more cash, suggesting that no one, not even children's pocket money, would be safe from taxation. Clarkson also painted a grim picture of what the future might hold: bans on things like tanning salons, meat, and wood-burning stoves to reduce pressure on the NHS, alongside an increase in migration to drive down wage costs. Ultimately, he argued that the system needs radical restructuring, or perhaps to be scrapped altogether. It's a bold claim, especially given that the NHS he derided had just treated him with care and compassion. And that's where the irony lies. Jeremy Clarkson may have walked into the hospital expecting hostility, but instead he walked out healthier, grateful, and still unconvinced the system can survive. The question now is, will Clarkson's latest hospital experience soften public opinion toward him, or only fuel more controversy around his outspoken views on Britain's most cherished institution?